Welcome to Babe, Can You Explain This? Where my husband asks the questions and I do all the explaining. I'm Callie Rivera. I'm a retired labor and delivery nurse, currently a family nurse practitioner, aesthetic injector, and CEO of Inara E Wellness. Each episode, we're diving into real conversations on aesthetics and wellness, from babies to Botox to biohacking, and everything else in between. He's here to ask what you're all thinking, and I'm here to break it down. This is Babe, Can You Explain This? So let's get into it. Hey, welcome to Babe, Can You Explain This? The podcast where my husband asks all the questions everyone is thinking, and I break it all down in a simple, understandable way. I'm Callie Rivera, board-certified nurse practitioner, advanced aesthetic injector, and your go-to girl for real, honest conversations about aesthetics, wellness, hormones, injectables, and everything in between. My goal here is to take the confusing, overwhelming parts of this industry and make them make sense in a way that's fun, approachable, science-backed, and totally judgment-free. So whether you're curious about Botox, peptides, PRP, or facial balancing, we're going there. And remember, everything I share here is meant to just educate and empower you, so it doesn't replace your medical provider's advice that fits your personal health, wellness, and aesthetic needs. Everyone, this is Javier, my husband of almost 19 years now. Wow, can't believe it's been that long, can you?
I can't.
Crazy. So just so everyone knows, Javier is very well versed in real estate and he's a certified interpreter, but he has no education in the medical field. So he's been supporting me, though, in my career for over 20 years in the healthcare industry. And so he's heard and seen a lot of things. So he has all the questions that you probably have, too. So let's get right into it. All right, babe, I know you have a lot of questions written down for me. You've seen a lot of stuff that I've done. I come home with lots of stories. So anyways, what is your very first question that you have for me?
So what is the most popular treatment you do in clinic as a aesthetic injector?
Great question. It is Botox. Botox is the number one treatment that I get asked to do. So when clients are booking with me, that is like most of my schedule. But lots of other things that I do, but Botox is the number one for sure.
So what is Botox? What does it do?
So Botox is a purified protein. And the way that I like to explain it to my patients is that it kind of acts like a hat, and it covers like the muscle fibers that communicate to the brain to tell your muscle to move. It acts like a hat, and it basically silences like that communication. So for a period of time, there's no communication going to the brain to move the muscle. So it basically relaxes it. So essentially that's what it is. Yeah. Does that help?
So I've heard you call it other names. What do you mean? Is that more than one Botox?
So the active ingredient is botulinum toxin A. And there's actually 6 on the market that are FDA approved for cosmetic and therapeutic reasons. So you've heard me call other names. Do you know any of them? Can you recall any of them?
No.
Okay. So Botox, of course, is the popular one. It's just kind of it's like the blanket statement that we say for this medication. But there's 6 brands. There's Dysport, of course, Botox that we just mentioned. There is Daxxify, Jeuveau, Letybo, and Xeomin. So they're all different brands, of course, made with different formulations, but they all have the same active ingredient, which is botulinum toxin A. But each formulation is just kind of curated towards that brand and kind of what they're wanting to like make the active ingredient do. But yeah, so it's really important to know what you are getting injected when you go, just because as an injector, it is one thing that I ask my clients, like if they've ever had Botox before. And some,
Right.
totally, they're like, yeah, I've had it. And when I go to ask them, oh, do you know like what brand? A lot of people don't know the brand that's actually being injected into them. So, and they all do have little slight differences in like their action and onset and duration. So it's super important to ask your injector, like, hey, what brand am I getting? Just so you know too.
Wow. So does Botox look natural, or that's going to change my facial expressions?
No. So if you go to a good injector, and I don't want to say like bad injector, because I think we all have to start out somewhere. So There's newer injectors that may not fully understand like the anatomy and how the muscles are moving and maybe where they lay in the face. Some lay up right against like the bone, some are right up under like the skin. So if you have a good injector with experience, you will look completely natural. It's not going to change the way that you look. We know exactly where we are trying to like target to just give you that refined, like refreshed look. I think what maybe you're referring to is when people have like the spocked brows or maybe like a crooked smile. Of course, that's a side effect from the product migrating or moving a little bit after being injected, and it's hit a different muscle that we don't intend to like to treat. But no, my purpose for Botox and giving that to you as a treatment is just to make you feel refreshed and just soften those lines. But yeah,
Now, when do you see the results? And how long the Botox last?
so results typically on average are going to be in full effect in about 2 weeks. It's kind of like a bell curve or almost like going up a mountain and then coming back down with the way that it like onsets and then kind of like gets out of your system. So onset, yes, is about 2 weeks. I will say that I have some patients that are super responders and I'll inject them and then like 2 hours later, they're already like, they can like see the result. Things are like working. Typically 3 to 5 days, you're definitely gonna like feel a difference. I always tell my patients to not judge the result until the 2 weeks because, like, for instance, I get Botox and I do have like one muscle on this side of my face that where like my eyebrow will like stay up. And it's literally day 14 that like it like relaxes. So I have a lot of patients that will like text me or call me like 1 week in and be like, "Oh my gosh, I don't think it's working," or "I look kind of funny because one brow is like going like this," or something like that. And I just have to like reassure them that it's gonna be okay, that in another week or so, it's gonna relax. It's gonna be looking normal and feeling normal. But if it's definitely your first time getting it, it's a little like you get a little anxious about it because you're just like, well, what's happening? And it is a weird feeling because you're normally maybe you have a really big smile, and when we relax certain parts of your upper face, it could like soften that. And so those are just all expectations that I do talk to my patients to in a consultation and tell them like how they're gonna feel and look. But I will tell you, Botox is one of the most studied medications in the world. It's got one of the highest safety profiles. There's been over, I think, like 5,000 articles written on it that are published in medical journals.
Oh, wow.
And I think by now, last time I looked, it was like 100 million. It's probably 150 million people now that have been like treated with Botox. So super safe, super satisfying. And I think that's why people love it. There was a doctor, I think I have a quote. There was a doctor back in like 2004. Her name was Dr. Ava Shamban. And she said, if Botox were lethal, half of Beverly Hills would be dead.
Oh, man.
So
Wow,
it's
amazing.
just funny because I do have a lot of patients that come see me for other things, and when I talk to them about Botox, like getting it, they're just like, "Oh no, like no way, I would never put that in my face." And I'm like, "Well," and then I tell them like all the safety profile and talk about it, and that it is if you're coming to a legitimate place
Mhm.
with a certified provider with the education and the knowledge, it's completely safe, and you're gonna look totally natural.
That's awesome. Awesome. So, there's any downtime after getting Botox, or can I go back to work right away?
Yeah, so this is a question that my normal response, or I guess my average response, that I've had over the course of injecting has been, we don't want you to exercise for 24 hours post injection. We don't want you to go into like hot saunas or do hot yoga or do any like thing in like extreme heat or extreme cold because you kind of want to like let the product settle. We tell you not to like massage or touch like your head or where we inject for like 4 to 6 hours. Or the biggest one I think that we tell people is like, don't go and lay down for 4 hours. Like stay upright, keep your head upright, don't look down. And there's some myths in there that we can discuss later. But yeah, I think the biggest thing is just relax and, you can wash your face later, give it a few hours, gentle cleanser. I always tell people to stay away from like their actives, like retinols and vitamin C's for a couple days just to like let their skin heal. But yeah, there really isn't both time, like a downtime. Like you can pretty much do anything right after.
Wow. So how many units do you think I need?
Okay, so that's a good question. That leads us into like where I kind of start my consultation. So I'll hand my patient a mirror and I'll have them like do muscle movements. So I'll tell them to like make an angry face, like look mad. I just did my Botox a few days ago, so it might already be settling in. So some of these faces I can't do, but usually I'm like, give me an angry face. So they'll make those lines appear in between the brows, and I'll have you like raise your eyebrows, smile, squint, so I can see like around here. I'll have you kind of bunch your nose up, see the lines in your nose. And I'll ask you, like, what is it that you're seeing when you look at yourself that you are concerned with? Like, what is it that you want me to treat or soften? So it really just it's a two-way street. It's not just me like being like, "Oh, this is what we need to do." I ask my patient first like what their concerns are, and then we discuss, you know, depending on what they want to have done, like what needs to be treated. So, for instance, men do have like larger, thicker muscles. So, on average, you will have a higher dose than my like female clients. There's been studies and research and it's published, it's out in books, but basically the treatment of like the angry, like the 11 lines, the forehead, and the crow's feet, standard average dose is 64 units. So people think that's a lot, but we are treating the frontalis muscle. We're treating basically this whole glabella. It's called a glabella complex, but it's procerus and corrugator muscles, and then the obiculus oculi muscle. So there's a lot of muscles in the upper face that we treat, and it does take quite a few units. Everyone is going to have my assessment's going to be a little bit different. So I will say an average, the glabella like 20 units is like average. The forehead 10 to 20, around the eyes 10 to 15. So I like to also kind of explain when I'm dosing. The muscle has all these neuromuscular junction fibers all throughout the muscle. So there's been studies showing how much Botox needs to be injected in that muscle to relax it. I was listening to Dr. Arthur Swift, amazing doctor, injector I watch all his education because he's amazing. But he was explaining how the muscle itself needs, like the Botox needs to cover 33% of the fibers in order for the muscle to stop moving. So when I'm telling you like your dose, I'm considering what's the minimum amount that I can inject to make it stop moving, but also what's the maximum dose I need in order to give you the duration. So let's say you come in and you have a small budget and you're like, can you relax this muscle? But you can, your budget's for like 10 units of Botox. I'm highly not going to treat you because it's a waste of your money. Because I know from doing this that it takes a certain amount of units to relax it, but to also give you the duration of 3 to 4 months, which is kind of like standard. And so you just kind of have to trust me that I know what that is. And Botox isn't cheap. I'm going to say it. Like, it's not cheap. And if you're going somewhere that's selling it for super cheap, I mean, honestly, you're probably going to someone that's new. And I don't know. There's lots of reasons, but it is not a cheap treatment. And it is something that you do every 3 or 4 months. So you need to put that into your budget. And because it is considered a maintenance like treatment, it's not something that you just do once and then never do it again. The whole point of it is to like prevent those lines that you see from like getting deeper. So if that like makes sense, like basically you want to keep doing it. Now you can get it done and then never get it done. Because I did have a patient ask me, she was like, so if I get it done, does that mean like I have to do it forever, like the rest of my life? Like, no, like there's a lot of patients that come in to get a treatment, like maybe for an upcoming event. They have a wedding, they have pictures, and they just do it once or twice a year. That's fine. But in reality, it is something that you do every 3 to 4 months.
Got it. Got it. Now, there's different quality on the product, or when you say other people have it cheaper, is that quality or is technique?
Definitely, it's going to be technique. Because I mean, for instance, when I was learning, I felt like, we put a lot of like promos out there to like get you in the door to like, I gotta like practice, right? Not that I'm practicing, but like, I'm just like in the beginning of my injecting days, like I may not have known as much as I do now. And now I'm very strategic with it. Yeah. So it's not the quality of the product. However, it could be. I mean, that's not to say that it could be because, yeah, I've seen some crazy prices for Botox. And I'm just kind of like think to myself, like, there's no way that that person bought that vial of Botox from the company to like for that price, Like it's expensive for us as treatment providers to buy this product. So there's a reason why, the Botox unit is $12 a unit all the way. I've seen it $17, $20 a unit in some places. So yeah, if you're seeing it less than like $8, $7, I'm not sure where they got it.
Now, is there anyone who should not get Botox?
There's a group of people that we kind of all know that never can get anything. And of course, that's pregnant women and breastfeeding women. But however, Botox hasn't been studied in that group of people. So I think as injectors, we take the safer route and we are more conservative and we choose not to inject when you're pregnant or breastfeeding. But I will tell you that there are neurologists that are injecting Botox in pregnant and breastfeeding women during pregnancy because of migraines, because it treats migraines. So it is being done. It's not to say that it can't be done, but we just, as I think industry standard, we just have that standard and we stay away from that group of people. If you are sick or on any antibiotics, there's a lot of medications that interact with Botox. So there are certain ones that if you come in and I'm doing my consultation and I'm asking you like what medications you're taking, you need to be honest with your injector because there are certain things that can interact, like make it less effective and stuff like that. And so that's another reason why it's super important to come to a provider that's, educated, certified, and that's going to be doing a thorough like medical history. So if you walk in somewhere and they don't ask you anything about yourself and they just want your money, like total red flag. Total red flag.
Now, Botox versus filler. What's the difference?
Yeah, so I get this a lot, which is interesting because I guess, I don't know why it's interesting to me, but I will have people come in and they ask for a lip filler or vice versa, lip flip, and they're totally two different things. So filler is a volumizer. So we place that in specific areas to give you volume or maybe where you've had some like bone loss when we're doing facial balancing. So it's a volumizer. Whereas Botox, again, remember, it's a wrinkle relaxer. So we're just kind of softening the lines, refining the skin. But to that note, a lip flip, do you know what that is?
No.
So that is where we place Botox in the orbicularis oris muscle. And this muscle naturally wants to like curl in. So when you smile, sometimes you'll notice people's top lip like goes under and like they lose their top lip. So what we can do with Botox is we can put it right above the lip. And basically when you smile, like it keeps the lip from curling in. So it looks like you got like a little bit of a lip enhancement, but it's just Botox versus a lip filler, which is the volumizer that we're placing inside the lip tissue to augment it or like enhance it that way.
Now, does Botox hurt? Be honest, brutally honest.
Okay, you've had it before. I've given it to you. Did it hurt?
You know what? It's been a long time. Don't remember.
Okay,
maybe a little pinch.
Yeah,
It wasn't like
actually I brought the needle because it's literally, we call these TB syringes, but basically diabetics use these to give themselves insulin usually. Tiny little needle, super small. Okay, we're breaking the skin. So there is going to be a response to your brain that something just happened there. So is it painful? No. I mean, it's a super fast treatment. It's done and over with within like 5 minutes. I also do a lot of things to like distract you. So I will like give you some like balls to like squeeze or like a vibrator, which I'll do like where I'm injecting. It kind of like distracts you.
Put a vibrator like on your forehead.
Yeah. I'll take like a
Mhm.
little vibrator thing, and as I'm like injecting your forehead or around your eyes or wherever, yeah, it stops it like competes for the pain receptor is what it does. So it like distracts you. Or I'll use like a little bit of ice like right before for a few seconds and then like inject you. So ultimately, I do have some patients that will ask for numbing cream, which I think is a little over the top, but
Okay.
I'm here for it all day. If you need numbing cream, let me numb your face. Let me numb
Okay.
it up.
So what else can Botox treat besides wrinkles?
Good question. So I took a course last year from Leslie Fletcher, amazing, amazing injector who I follow and everyone should follow. Giving her a little shout out here. But I took her course called 75 Obscure Uses of Botox. 75. So there are a lot of things that people do not know that we can use Botox for. One of the most probably like popular ones or people that know about is migraines, like we mentioned, and then sweating armpits, like
Okay.
super like it's hyperhidrosis, what it's called, but super super sweaty armpits. Like if you're just someone that just like sweats profusely, sweaty palms, sweaty scalp, that can be used for that. But yeah, so since I took that course, I am actually a licensed provider for microtox, nasal tox, and theratox.
Are you?
Yeah. So we can use Botox in a sense to use it as like a how do I want to say it? It's almost like saran wrapping your skin. So when we place it in the dermis and not in the muscle, it's like shrink wrap. And so I can do all these fine little like injections. One of the most requested areas is like around the eyes and under the eyes, like that crepey skin. So there's a technique that I can do to like get the under eye like super smooth. Places in the face that no one or maybe like a new injector would absolutely be like, oh, no way, we would never inject there. I can inject there. So the fine lines like around the mouth, the chin. It's really good for people that have like rosacea even, or even acne. I notice even in myself, like when I have breakouts, I'm like, oh, I know it's time for like my Botox because it really helps like close up those sebaceous glands that are in your skin. And that's what it's doing basically in the armpits too. It's that it's like just like closing those sebaceous glands and you're not going to sweat as much. And it lasts like 6 months to a year for some people. Oh, the other treatment that we do is for TMJ. So like jaw pain, we can treat. A lot of people are doing that now. That would be considered more like theratox. So for like a medical reason, TMJ. What's another thing? Like deep muscle pain. So myofascial pain, we can inject like pretty much anywhere in your body. Plantar fasciitis, tennis elbow, neck pain. You just come to me and I'll shoot you up with Botox all over.
Now, what are you saying that the armpit sweat?
Yeah.
That's just a sweat or the other also?
Well, I mean, it's targeting the sweat glands, which obviously when you're sweaty, that there's some sort of odor, but it's mostly for like the sweating. I will say that it takes like 50 units per armpit. So you're looking at 100 units for that therapy. So a lot of these therapies do like you have to have like a lot of Botox. Like the migraine protocol that I have uses between like 150 and 200 units of Botox. But I have patients that swear by it and they come see me every 3 months for it. And it's really, really like controlled their migraines.
Wow. When you say units, what's for our public? What specifically is like 3 ml, 5 ml, 10 ml, 1 syringe? What is it?
That is a good question because we reconstitute, the Botox comes in like a powder and we have to reconstitute it and make it into a fluid so that it will like kind of like spread. So depending on the area of your face that I want to treat, I will reconstitute it with a certain amount of like saline. Um, and based on that number of how much I'm diluting it with, it's kind of a complicated question, but basically, on the syringe, this syringe has 30 units. So let's say I dilute my vial with 2 mLs of saline. Basically, 2 of these little hash marks is going to be 1 unit of Botox. And this is my typical like dilution is the 2 to 1
Okay.
for the full, the upper face and everything. Now, when I get to the lower face, I'll do like a 1-to-1 solution. So then that basically means every little one like hash mark is 1 unit. Also though, but for like bigger areas like the trapezius muscles, or for the armpits, I might do a 4-to-1 dilution. So then that means like the 5 or the 4 is like 1 unit basically. So it just
Got
means
it.
the more that you have, the more that it's like going to spread. So I do get, that is a good question because patients do come in and they do have some knowledge and they'll kind of ask me like, oh, are you diluting it? And well, no, I'm not diluting it. I'm reconstituting it to the amount that I want the product to like spread.
Got it. Now, for you, what's your favorite treatment?
My favorite treatment has been the Nefertiti neck lift. You know what that
Okay.
is?
No, say it again.
Nefertiti. Can you say it?
No.
Nefertiti.
Nefertiti.
Yes. So it's placing Botox in the jawline
Okay.
and in the platysma muscle. So your platysmal muscle starts at your collarbone and it wraps up around your jawline, and it basically is a depressor muscle. So it's constantly like pulling on you. And then you develop like the jowls here, and I don't know, just like everything just starts to like drop. So
All
what
right.
it does, Botox does the opposite of what your muscle wants to do naturally. So the platysmal wants to pull down. So when we relax it with Botox, it's like it goes up. And then what happens is your muscles in the upper face compensate. And basically, these muscles pull the rest of your lower face up. Do you get it? Does it make
Yeah.
sense? Yeah.
Yeah.
So you end up with
Just
like,
trying to picture it.
yeah,
Mhm.
you end up with like this amazing like jawline, smooth neck, and it will last a little bit longer than like your upper face tox. So I usually do my jawline like every other time. Again, it is an area that takes a lot of units, so don't want you to be shocked when you go in. It can take anywhere from like 60 to 80 units, especially if we're hitting like the neck bands. Can you see?
Yeah.
Do it. Like say E. Yeah, so I usually tell my patients to say like E, and then they like pop out, and then I know where to hit them. But that's been my most requested treatment too lately. But yeah, it gives you that like snatched look.
Oh wow. Oh wow. So what's there's any myth about Botox?
Yes. So this kind of brings me back to the question where you were asking me like, is there any downtime? Because there are some myths. One of them, and some of these are like super like shocking to me because I feel like I've been saying like the opposite to people. But one of the things is you don't want to ice after you get Botox. So some people will get a bruise. That is something that can happen, and people automatically want to put like ice on it. No,
Yeah.
don't do that. It can actually like Botox is actually temperature dependent before it's actually attached to the fiber. So it can reduce like the uptake. So that's one. Muscle activity. So after I inject you, you should like move those muscles. So like if I inject your forehead or your upper face, your crow's feet, you should like do that.
Even if you can't.
Well, you're going to be able to do it for a while. But yeah, it's going to basically like, it's going to improve like the effects actually. There's been studies on it. The other one is that UV radiation, so the sun, does affect your Botox. So I tell all my patients, I actually almost put sunscreen on everybody after their treatment just to remind them also that they need to use sunscreen because the UV will break down the molecule a little bit faster and degrade it. So that was one thing. Okay, so remember how I told you like no exercising for 24 hours?
Yeah.
So, myth. Exercise does not affect Botox.
Good.
Didn't know. No research has ever proven that it has. I think the reason maybe why we say it still though is because when you exercise, your heart rate like increases and like your blood pressure increases. And so if you have a bruise or something going on, it can make you swell or bruise more. So that would be maybe one reason why we still say it, but it actually doesn't affect the Botox. Other thing is I always tell people to not like touch or massage the area for like, well, normally we say like 4 to 6 hours, don't touch, don't wear a hat, don't lay down, like all those things. Actually, massage does not affect Botox. But there's a caveat to that. You shouldn't probably touch or massage the area for about 30 to 60 minutes. It doesn't have to be like 4 to 6 hours though. So that's something.
Okay.
Lying down does not affect Botox. And I swear, we tell everyone, do not go home and lay down. That's like the number one thing people want to ask. So you can go home and lay down. There's also never been research that shows that it causes migration. And then another one that I'll get asked to is like people that are traveling, they want to come get their treatment, maybe like the morning of or the day before they're traveling. And no evidence has ever been found to prove that traveling, like flying, cabin pressure would like increase or potentially lead to like toxin spread. So you're good to travel.
Good. What is the one tip you will give to patients regarding
Hmm.
Botox?
My one tip is that if you have an event coming up, your wedding, pictures, I don't know, a nice dinner date that you have planned for, your birthday, do not come in a day before and ask to get your Botox. It will not take effect by the next day. I always tell people 2 to 4 weeks. Best is 4 weeks. That way you can come back at 2 weeks and if you need to have like a touch up or tweak something, that's going to be the perfect time. So 2 to 4 weeks before an event is when you want to come get your Botox.
Perfect. Now, what is the one tip that you will give to the injectors?
Yes. So for all my new injectors out there learning Botox, it is one of the most fun things to do. It's one of the most satisfying treatments to give your patients. However, it's one of the more tricky ones because when you inject, you don't see the result right away. So you don't know whether or not you did a good job or you treated it right or whatever. So my biggest tip when you're learning is to require your patients to come back in 2 weeks for a follow-up. Because then you're going to get pictures and always take pictures before and after pictures. That's number one. Number two is have them come back in like 2 to 3 weeks to get pictures again of having them do those faces, those, animations, and then comparing them, showing them to your client. Because a lot of times clients come in and they're like, I don't see a difference. And then you show them like a before and after, and it's like, it's huge. It's literally, and then they're like, oh, whoa. And so it's super, super important to have them come back and follow up so that you can show them their pictures and that you can also learn from your techniques that you've been doing to know whether or not, oh yeah, that was a good treatment. And then just moving forward too for that patient, you kind of know like that was a good treatment, that was a good dose. So yeah, do you have any more questions for me?
No, not at all.
No?
You're very, very
Did
knowledgeable.
I explain it well to you? You understand it? All right, babe. I think that wraps up today's episode. Our first one of Babe, Can You Explain This? I hope you learned something new, you laughed with us, and feel a little bit more confident navigating the world of aesthetics and wellness. My goal is always to make this stuff make sense because when you understand your body, you make better choices for it. So if you love this conversation, don't forget to follow, subscribe, and leave a review. It helps us reach more people who need honest, no BS education about Botox, filler, hormones, peptides, and everything in between. You can also follow me on Instagram. I'm Injector Callie for more tips, behind the scenes, and real patient transformations. So thank you for listening. Until next time, stay curious, stay confident, and keep asking the questions everyone else is too afraid to ask.
Thank you, Callie. Thank you, everyone.
Thanks, babe.